Hi there. Welcome. Please come in. Please have a seat. I think you're here for a full eye examination today, right? Okay. Very good. So let me just prepare everything and then we can get started. So yeah, you can just sit back and relax, and let me just see what is on the agenda today. Like, I've got my computer over here. Yeah, like today will just be a really gentle, simple, non-invasive checkup. And yeah, let's just begin by verifying a few details, if that's alright. So, can I have your full name, please? Okay. And your date of birth? Okay. Great. Are you wearing any contact lenses right now? Or do you usually wear glasses? Okay, I see. Alright. We will take that into account during the test. Have you experienced any of the following recently? So blurry vision, eye strain, headaches, sensitivity to light, or trouble focusing on objects near or far? Okay. Okay, thank you for sharing that. Like, that helps me better understand what to look for today. I'll just note everything down. So before we start with the tests, I'm going to take a quick look at your eyes. I'll examine the shape of your pupils, the sclera, and your overall eye movement. So just look straight ahead for me, please. Try not to move your head, and yeah, only your eyes if needed. So I'm just going to inspect your eyes real quick. Right. Okay. Perfect on the left eye. Now let's move on to the right eye. Okay. Let me check the left one again real quick. Okay, everything seems alright. Let me just note this down. Now follow the light with your eyes again, please. Like, keep your head still again, just only focusing on the light with your eyes. I'm now going to move the light in a different pattern, and I just want you to follow the light, alright? Okay. Okay, very good. Your tracking looks great. Now I will gently pull down your lower eyelids, like one each, just a bit, like, don't worry. Just to inspect the conjunctiva real quick. This shouldn't feel strange, like, actually you shouldn't feel anything. Like, I'm just going to be really gentle with it, like it doesn't hurt at all. It's just basically like you would do it by yourself, maybe if you've got something in your eye or something like this. So let's just do that real quick. So I'm going to start on the right side this time. Okay. Okay, very good. Now the left. Okay, very good as well. Yeah, no redness, no swelling. Everything looks really healthy so far. Now I'd like to measure your pupil size under normal light. Let me just get my measurement device, my measurement ruler. Let me just get my ruler and yeah, so let's start on the left side. Okay. Looks like around 4 millimeters. And the right side looks okay, around the same. Just about the same. That's both within the normal range. Next, we'll begin with a visual acuity test. That's the classical letter chart. Alright, so that's the chart here. So you will basically be reading some letters out loud for me now. So cover your left eye, please. Let's start on that side. And just gently with your hand, like this. Okay, perfect. And now please read the smallest line you can see clearly. Like this. Okay, that one. Okay, good, wait. I'm going to note it down, okay. And now please read it. Very good, like you get almost everything correct, most of them. Excellent job. Let me note this down. Okay, now please cover your right eye and we'll do the same again. Again, the smallest line you can still see clearly and you can still read. Okay. Okay, that one was totally correct. Okay, very good. So let's now check your near vision. Like actually, I used to have tiny cards for this one, but as I said, we are currently redecorating everything, so let me just see where it is. Oh yeah. Alright. That's the next thing we're going to work with. Alright, now please read aloud what you can see. So I'm just going to tap on certain parts of this chart and I just want you to tell me like what you can see, what you can read, if you can see anything. And yeah, let's just start really simple. Can you see this? Okay. And now this. Okay. Now let's do this. Like where's the opening? Okay. Now this one. this one. Okay. And this one. Like, please tell me where, like, to which side this E is showing, basically. Okay. Okay, correct. And then, like, the smallest one is really hard to tell. I don't know if you can see it clearly. Okay, yeah, please read the numbers. Okay. Okay, perfect. You got, again, almost everything correct. Not every single thing, but almost. Okay, that's really good. And that the letters, or like all of these signs, did they seem crisp and clear, or like did they blur slightly? Okay. Okay, I see. Alright, now we'll check your peripheral vision. Please look straight ahead at my nose and tell me when you see my fingers appearing in your side vision, alright? Okay, let's get started. Alright. Okay, very good. Now we'll do it like this, like on the upper left side. Okay. Alright. Okay, very good. And the other way around, like this. Alright. Okay. Alright, very good. Alright, you're doing a really good job. We are going to take a break in a second, but first I would like to measure your eye alignment real quick. Please look forward again, and I'm going to shine a light into your eyes again, like real quick, or like around your eyes, and just measure your eye alignment. Alright, so let's see. Alright, at a distance. Okay, seems good as well. Alright, aligned perfectly. Alright, I'm just going to write down all of the results real quick, or like the results that are still missing in this form that I need to fill out. And then we are going to move on to the next part of the exam, so like you can just, yeah, relax for a while. Like, I'm just going to type all of this in real quick. Alright, now we'll continue with color vision. I'll show you a series of different, actually it's cards, but like of different paper sheets today. And basically each of these papers has a number or a shape embedded in a pattern of colored dots. And all I need you to do is to tell me what you see, basically. Like if you see a number or anything else, and which number, or what do you see. Alright, ready? Okay, let's get started. This one is the first one. What do you see? Okay, very good. Now let's try this one. Okay, what do you see? Try to focus on the middle when you're looking at it. Okay. Now the next one. Okay, so yeah, that's correct. So you think this one is easier than the previous one. Okay. Alright, one more. This one is trickier. Okay. Perfect. And now we've got a slightly smaller one, like this could be the last one, I think. Okay. Alright, actually your color recognition seems completely normal, but if you like, we can also continue and you can, just name me all of the things you see in these charts. Okay, let's just continue. What do you see now? Alright. And what do you see now? Yes, alright. What do you see now? Okay. And now? Like, try to focus on the middle again, and then maybe you're going to see it. Okay. And one last one. Yeah, correct. Alright, very well done. Your color recognition seems perfectly normal. Let's now test depth perception. I'm going to slowly move my fingers towards you, and I want you to tell me which one appears closer. Alright, so like take a look at both of my fingers, and I'm just going to move them forward, and one is going to be closer to you. And please tell me which one, alright? So which one is closer? Okay, correct. And which one is closer? Okay, correct. And now. And now. Even. Okay, perfect. And now. Okay. And one last time. Okay. All right. Alright, now I will test your convergence. That's how your eyes track objects coming closer to your nose. I am going to use, I will use this pen light. I'm not going to turn on the light, but I'm just going to use it because it's easy to follow basically. So just please follow this pen light with your eyes as it comes closer to your head. Again, not with your head, like try to only focus on it with your eyes. Okay. Very good. Very good. Let's now move on to coordination and focus switching. I'll ask you to look at this object that I'm holding. I'm just going to use the pen light again. And so please try to focus on this object and then shift your focus back to my nose, and then back onto the object, and then back to my nose. So my face is going to be further away, and this pen light is going to be closer, and then please try to be like close, far away, close, far away. It's almost like what we just did, but like it has a slightly different purpose. So let's just do that. So the pen light is over here, and over here is my nose. Alright, nose, pen light, nose, pen light. Focus on my nose and on the pen light. And again on my nose and on the pen light. And on my nose and on the light. And on the nose, on the light, on the nose, on the light, and on the nose again. Alright, perfect. Very, very good. Alright, now I would like to perform a quick eye muscle test. We have 6 muscles in each eye, and I want to make sure they're all functioning well. So yeah, is that alright with you? Alright. Alright, please follow the tip of the pen light, again, just with your eyes. And I will just guide you through a pattern again, like just follow the pattern that I'm showing you basically. And try not to move your head. Alright. Let's see. Alright. Yeah, try to keep your focus on the tip of the light. Very good. Alright. Alright. Very good. No lag or hesitation. Now we will do a reaction and blinking test. I'm going to bring my fingers close to your eyes and yeah, just act naturally, and whenever you feel like blinking, just blink. Alright. Very good. Your natural blink reflex is perfect. Alright, now I would like to test your visual memory. Really quickly, really briefly, I will show you a series of numbers on these cards. And I want you to repeat them back to me, okay? So like you can remember them in your head. Like you can be like 0, 1, 2, 3, like that's now easy, but like 1, 2, 3, and then after 1 or 2 seconds I'm going to ask you to repeat them out loud to me, and we'll just see how well you can memorize things. This is not totally about the eyes, this is also a lot about your brain. This has to do a lot with your brain actually, but we are still always testing this, even if you come for an eye exam, for an eye checkup. So yeah, let me just grab a couple of cards. Alright, let's start. This one is the first one. Okay, remember it. Now, alright, and the last one. Which numbers did I show you? Okay, correct. Now let's do this again with one card more, one additional card. Alright, first one. Okay, the second. Alright, and third. Maybe I should stop saying no. First, second, third, and the last one. Alright, which numbers did I show you? Okay, correct. Now let's add one more card. And change the order a bit. Alright. Do you remember the whole, like all numbers and also the order? Okay, everything correct. Very well done, very good. Like, I don't know if I could do it like this. I'm not so good with memorizing things. So, perfectly done. Really excellent recall. Like, I think this was by far the best result, like for the whole week now, because you really did not make one single mistake. I think yesterday I already had one patient who only had one thing incorrect for this task. So yeah, very good. Very good job. Alright. What else do we miss? Alright, now I've got a couple of more questions. Have you ever experienced floaters, like dots or shapes drifting in your vision? Okay. And what about flashes of light, like especially in dark rooms or when closing your eyes? So like you close your eyes and then you just still see some bright light, and actually it's not really, like actually you've closed your eyes. So okay, I see. Okay, I see. Okay, that's very helpful information. How often would you say you use a screen during the day? Like your phone, laptop or desktop, television and so on? Okay. Okay, quite a bit. Okay, that's understandable, yeah. Do you notice any fatigue, dry eyes or light sensitivity after long screen exposure? Okay. Okay, we'll talk about what you can do to reduce those effects in a minute. Alright, let's now test the ocular alignment with a simple cover-uncover test. Please look at my nose again, and I will cover one of your eyes and then switch quickly and cover the other one. And yeah, please tell me if anything shifts in your vision or if everything stays the same. Alright, so let's see. Did you notice any changes in your vision? None. Okay, that's very good. Alright, you're doing really well. We're nearly finished with the full assessment. Would you maybe like a sip of water or just a small break? Like, I'm just going to finish my notes. You can just have a quick break now. And we are almost done. I promise it won't take that long anymore. So actually everything seemed fine except for the very first test which we had with the charts. So like that was also still really good, but you made a few mistakes. So let me just like if that's alright with you, like I would just like to maybe try a couple of glasses on you, like to just see if maybe you will get to see a little bit better with them. So let's just try the lightest we have. Like this one is just a really slight correction. Okay, now. Okay, they work well. Okay, that's really good. But if you'd like, we can also test a slightly stronger one. Let's test this one. So this one is not good. Alright, this one is not good. So if at all, this one would potentially work better. Alright. I'm just going to note this. So like you might not need full-time glasses, but like a very mild prescription could help reduce fatigue, especially during extended screen use. So I'm just going to write this down now. I'm going to give you a prescription, and then if you feel the need, you can just go get yourself some glasses. And I'm also going to give you some glasses which are going to reduce the blue light from the screen. So no corrective lens, but just a blue light filter. So alright, so yeah, it's nothing urgent. Like at the next checkup we are going to see how we are going to move on further. Maybe your vision will be better, maybe your vision, if it might get worse, like your vision is really good, so like, but just in case you might experience slightly more problems the next time, you can really get some glasses for at least for the screen work. So a few things you can do when it comes to the screen light. Like I also have to spend a lot of my time in front of the screen, and then if you come home you watch some TV, or like you also take a look at we all take a look at our phones quite often. So like the first thing you can try is the 20-20-20 rule. So like every 20 minutes take a break for 20 seconds and look at something at least 20 feet away. So like look outside of the window. Like I also always try to take a break for at least a minute or maybe even 2 minutes, and then like maybe once in a half hour. This is also what you can remember. So yeah, around about every 20 minutes take a break for 20 seconds and look at something at least 20 feet away. This just gives your eyes a moment to reset and refocus. And then the second thing, like you can also try to reduce your screen brightness, like especially in the evening, or use blue light filters, or use this blue light filter glasses. Like these are with a slight corrective lens, but I'm also going to prescribe one to you which is only the blue light filter. So yeah, but basically like the third thing is to just pay attention to always blinking regularly. Like we blink less often when just staring at screens basically, which can lead to dry eyes and irritation. And so like this, especially after long screen time, after using the screen for an extended period of time, it can sometimes happen that your vision is impacted a bit for like 5 or maybe up to 10 minutes. Like this is a problem I also have personally, so yeah. Like I always try to blink regularly and really always try to take my breaks. And then of course there are a few habits that can really make a difference, like for your eye health. You can try to get enough natural light during the day. You can try to maybe take a walk for 30 minutes every single day. And yeah, stay hydrated. Like this really helps with tear production. And of course, if you wear makeup, make sure to remove it fully before going to bed. And also, we should really also all clean our phone screen more often. This is also something I only did in order to take care of my skin, as an example. But we also touch our eyes a lot, like even if we're just wiping through them a bit. And so we don't want to get any bacteria from the screen of the phone or from the phone in general into our eyes. So yeah, this is also important. Or like in general, try to wash your hands before touching your eyes. Like this is also really important. And if you ever notice any changes in your vision, like sudden blurriness, floaters, flashes, or discomfort, it's always a good idea to check in again. Like even if our next appointment is only in a half year, I think, but like you can always come back earlier if you wish. So yeah, you really did a really good job today. Thanks for your time, thanks for your cooperation. So yeah, if you ever feel the need to get an additional checkup before the next regular checkup, don't hesitate and just come for an additional checkup. So I wish you all the best and see you at your next appointment.